Welcome, everyone, to today's webinar, How to Find a Therapist, led by Rebecca Morse and Karen Morales. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to Rebecca and Karen for joining us today. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate the question and answer. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us, and I will now pass the workshop over to Rebecca and Karen.
Thank you so much, Sierra. Hello, everyone, and welcome to our webinar of today, How to Find a Therapist. My name is Karen Morales. I'm a social worker here at Dana-Farber, and this is my co-host and colleague, Rebecca Morswell. Have her introduce herself as well.
Hi, so grateful that you guys are all here today. Yep, my name is Rebecca Morse. I am a social worker in the Perini Clinic for Pediatric Survivorship. And we're really excited to chat with you guys today about how to find a therapist because we know that this is a struggle that many people have. So, yeah. So I'll go through a little bit of the agenda. So we're going to talk, just so you guys know where we're going with today's session. We're going to talk about why you might want to go to therapy, and then different types of therapies you might have heard about and different types of therapists. We're going to talk about where you would go to start your search for a therapist. And once you're in therapy, what do we do? And how does that beginning of therapy look? And then we'll give you some resources at the end so you can start the search on your own.
Yeah, and I just want to include that we will be taking questions via the chat. We just ask that your questions be general, and if you have any specific questions, then we can provide our information at the end so that you are able to reach out and ask us those specific questions if you have any.
So I'll start with why you might want to go to therapy. And we'll kind of skim over there's a lot of writing on all of these slides. But kind of the general idea is most people have some reason they may or may not want to go to therapy. A lot of people who are dealing with cancer or cancer survivorship have had significant external stress, and it's a really good place to go talk about some of that. A lot of times people are managing different interpersonal relationships or conflicts. And a lot of times people are processing things that have happened to them that are really hard. So a therapist is a really good space to help you process through all of that, a space to talk. And they also can give you some really good strategies to deal with symptoms. So if you're experiencing a lot of anxiety, a therapist is a really good person who can say, here's some concrete ways that you can manage that anxiety so you can go about your regular day and so that it doesn't impact you so much. So we're going to talk about some common types of therapy. I have this little umbrella here because I think of, therapy as an umbrella term. There are a lot of different types of therapy underneath that. So one therapist is going to practice totally differently from another therapist. And the most important thing to know is that there may be a different type of therapy that's a better fit for you than something else. So you'll hear about talk therapy and cognitive behavioral therapy in the next couple of slides. You may hear about specialty types of therapies. So some of the big ones are the group therapy, where you would be with a group of other people who are having a shared experience and talking through with them. Family therapy, a family therapist tends to sit down with the family unit and helps you look at the dynamics of your family versus your individual self. There's some other niche kinds of therapies, that use really interesting science, like biofeedback uses electrical responses to help you manage your emotions. And substance use treatment is a whole other kind of therapy that's really like behavior based. If we talk about talk therapy a little bit, That's probably the type of therapy most people have heard of or have some exposure to, whether it's through your friends and family going to that or seeing it portrayed on TV, sometimes better than others. Talk therapy is really about helping you find insight into your emotions, behaviors, experiences. It's a safe, warm place. As therapists, we tend to use the phrase like it's a container. So you walk into a therapist's office or their virtual office, and it's a space for you to really just process, and the therapist holds the container for you to have that space. And a talk therapist also may do some problem solving with you and help you figure out what you want to do about a certain issue or a certain problem. And again, this is an umbrella term. So there are a lot of different types of talk therapy, but this is, a more broadly. The other kind of therapy that we hear a lot about is cognitive behavioral therapy. So, cognitive behavioral therapy is different because it's more focused on your specific symptoms. So, if you have panic, worry, phobias, etc., the cognitive behavioral therapist is going to look at that specific symptom and then a concrete solution for that symptom. So, they're going to focus on having you develop more adaptive thoughts, feelings, and behaviors that are going to help you to manage your way through that symptom. And often, cognitive behavioral therapy is homework based, even though I hate that word. You use the skills that you develop during the session, you're going to take those outside of that session and you're going to work on it through the week and then build on that every week with your therapist. And now there are many therapists who combine cognitive behavioral therapy, talk therapy, and all kinds of other therapies into their practice. So it's really important to talk to your potential therapist about what is their style, what do they like, what do they use, and also if you have some insight into your own style and you're going to do really well with someone who gives you a task and you can handle that task and then move on to the next one, letting your therapist know that and they can tell you, are they going to be a good fit for you or not? Um, so, as you go along your search, you're also going to come across a lot of different types of people who provide therapy. So, we've got some examples of these, but this is not a comprehensive list at all. But people who can provide therapy tend to be trained as clinical psychologists, clinical social workers, mental health counselors, certified substance use counselors. You're going to see all kinds of letters after people's names, and they might be different, but these are some folks who do therapy. The difference between a psychologist, social worker, counselor, and a psychiatrist or a psychiatric nurse practitioner is a psychiatrist has been trained in the medical model and they can prescribe medication. So typically, you're going to see a psychiatrist or a psychiatric nurse practitioner really managing your medications and helping you from a biological standpoint, but there is some overlap. Some psychiatrists will do some therapy. A clinical psychologist or a clinical social worker will not be prescribing you medications because they just don't have the training for that. Um, and you're going to find therapists at many different types of practices as well. So, here at Dana-Farber, we have therapists who work within the clinics and tend to provide more short-term care. You will also find outpatient therapists at small group practices where there's maybe one or two of them, at large clinics where you might have 10 or 20 therapists all working together. And quite often you find therapists who are in individual private practice, which means that it's one or two people who, have an office or work via telehealth. And there's no better or worse situation for any of these therapists. It's really based on you and what you need and what you want out of therapy. So I always kind of say if you have more complicated needs, you might want to be at a bigger clinic or somewhere that has a few different therapists who you will only be working with one of, but those therapists can bounce things off of each other. And an individual therapist is going to be going to have other pros and cons. They're going to have the ability to spend probably more individual time with you, but they won't necessarily have the other colleagues at their practice to bounce things off of. The most important thing is that we want you to be looking for licensed professionals. So there are therapists out there who have different types of licenses, whether that's psychologist or social worker, but just making sure that they have a license. And on to the next slide. Um, and then the other thing that we come across quite a bit lately in the post-COVID world is just like this session right here, many therapists have moved over to teletherapy. So teletherapy again has its pros and its cons. There it can be really flexible. It can help people who might be kind of all over the place or working busy hours or whatever it is. It might help you to access therapy in a way that, driving to somebody's office might not. It also, some people do better in teletherapy than others. Some people really crave that, one-on-one in-person body language, and knowing about yourself what's going to work better can be really helpful, but it also can be helpful to just try it and see how it feels. Um, the things that are important about getting into teletherapy is you need to be able to have a private, safe space to talk. So if you've got, people around who you don't want to have hearing your conversations, it might be better to try to find an in-person therapist. It's also important to note that your therapist who you're doing your teletherapy with needs to be licensed in the state where you are at the time of the session. So if I were to see a patient over teletherapy, they would need to be in Massachusetts at the time of the session because I'm licensed in Massachusetts. So when you're starting your search, looking for therapists who are licensed in your state is going to be really helpful. That comes into play a lot with like college students or people who live in two different places. Finding a therapist who's licensed in both of those places can really help you find someone who's a good fit. And oh, sorry, I'm messing up the slides over here, guys. But we also want you to start thinking about what you're looking for in a therapist as you start to reach out to therapists. So a couple of good questions to ask yourself. What do you need in a therapist? Who have you connected to in the past? Often I'll say to people, when you were in school, did you connect really well to a certain type of teacher? Did they have a warmth to them, or were they more like concrete? Who are the people that you feel like you've been able to talk to? And it's okay to not know what you're looking for in a therapist before you find the therapist. You may have to try a few different people out, and that's totally normal and expected in the therapy process. So I am going to turn it over to Karen.
Thank you so much. So really in this next piece, we want to think about, where do I even start? I know that may be a question on your mind, like, okay, I have this information now, what do I do with it? So next slide, please. So a great place to start, I always think, is your PCP. So a PCP can certainly often provide medical treatment for the mental health concerns, but also note that there may be times where the provider may place a referral to, let's say, a psychiatrist who can, as we learned, also help with mental health concerns and prescribe medication. Additionally, the PCP may work with a clinician inside their practice, so they may place a referral to that clinician. Or if not, they may know someone within the community and say, okay, I can refer you to this person outside of the clinic. Next slide. So another important piece to also think about is how is this going to be paid for, right? So one thing we do want to highlight here is the insurance. So please, I recommend contacting your insurance provider, because most people do use insurance to pay for therapy. And I always recommend maybe reaching out via phone. You can contact the number. If you look at the beautiful animation, there's a little arrow, and most insurance cards do have a number in the back. Sometimes it may be differentiated by like a number and then like a behavioral health cards, which I think more now I'm starting to see insurance cards that have that designation. So I would encourage everyone to reach out, and then you can ask them, what services are covered? Do I have a copay? Do I have a deductible? Even asking how many sessions are covered. If I do want to look for a therapist and I want to engage in those services, you can also ask, do I need a written referral from my provider? How does that process work like? And then you can also ask if your policy covers out-of-network care. So two terms that I do want to just highlight here as I had finished off the last slide. So two words is one is in-network and the other one is out-of-network. And what's important to know about these two words is for in-network, essentially the clinician has a contract with your insurance. And you may have a copay, coinsurance, or deductible. So when we think about copay, normally, right, if we go to an appointment, we'll get that a copay. So that's essentially what kind of that in-network provider is. It has a contract with your insurance, there'll be a copay. Now, when we look at out-of-network, this is where a clinician does not have a contract with your insurance. So essentially, the insurance company may reimburse that portion of a session after you meet a coinsurance or deductible. So this is why it's important to call your insurance, as I mentioned, and really ask these questions just so you know what you're getting into. And additionally, the last point we did include I would say an organization or company that does help with submitting documentation for insurance reimbursement. So if we want to take kind of 10 seconds, just so if anyone wants to write this information down or, this website, please go ahead and do so as it can be a resource for you. All right.
Just give that a second. Okay. And we're going to move along, but if any of you want us to go back to any of these resources at any point, just drop it in the chat.
Yeah. Perfect. And I did want to also share this example. So some insurances, not all, but some insurances do provide websites such as this one, where it may be a little bit easier to find out information. As you can see here, this is Blue Cross. It says, find a doctor, estimate cost. So this is specific to this insurance. But once again, you can call the insurance. You can even ask them, hey, do you have a website? Do you have a list that I can, utilize, see what's out there. So this is just an example, but I do recommend still reaching out and asking what information does your specific insurance have, because everyone is different. So another resource that I did just want to highlight as well, which I think it's important depending on your age, but really utilizing the schools and the workplace. So we do know some schools, especially for maybe younger age, right? There are adjustment counselors, therapists often within the school, colleges as well, oftentimes may have a counseling center that students can utilize. So we encourage that utilization, that resource, because, in these counseling centers, there may be resources that the school is able to provide out. As well for workplaces, some workplaces do have EAP programs. So I would definitely recommend checking in with your HR to see if this is a resource that is offered. And another resource to utilize is your community groups. So this is really thinking about your friends, your family, clergy, or spiritual religious groups that you may be associated with, local hospitals, community centers. These may not be doctors or your care team, but it's really thinking about using your resources around you, using maybe your neighbors or using your resources that it's like, oh, it's a phone call away. I can call a friend. I can call a family member. Or I know someone who told me that a friend of theirs used X, Y, and Z service, right? So it's really thinking about kind of using who you know around you, because they may have a resource for you that is exactly what you need. So, utilizing them and reaching out if you feel comfortable, of course. So another service that we did as well want to highlight is these two services that we have here, and please feel free to take a picture, write down the information, write down the number. But these services are essentially professional matching services where you can reach out, call, and someone will essentially assist you and help you with that matching, right? So this one is a little bit more of that collaboration with someone and saying, hey, this is what I'm looking for. This is what I need. Can you please help me? And on the flip side, we also wanted to include this resource, which is more of the kind of self-service, it's a provider listing that's online that you can log into this website. What's great about it is you can filter results, so if you want something specific as a location, a type of therapy, if you wanted to for it to focus on a specific, let's say, topic like illness, marriage, family, you're able to do so. And, obviously you will probably see a lot of options. So from there, you can kind of skim through, see who you feel is calling out to you. There's normally a number, a contact information for the person that you can kind of pick and see what works for you. So just some helpful hints that we did feel that it was important to highlight. So when you reach out, we ask, leave a phone message. Most therapists do normally respond within 1 to 3 days, but we do also just want to highlight and note that when we think about a therapist schedule, most of the time they're back to back. Most sessions are, 40 to 50 minutes, maybe an hour. Every clinician does practice differently. So we do ask that you have a little patience in the sense of, okay, I'm reaching out, let me wait, let me see. And as the next bullet point or a couple bullet points is, check back 3 to 4 days after, if you're still not hearing anything, send that email, feel free to say, hey, just want to circle back in this. But we do ask that, you consider that they're back-to-back appointments. They may be trying to reach people in between sessions, but they will, essentially be reaching out when they can. And also remembering that some providers do have a wait list. Some of them have an intake process. And what that means is when that point of contact comes, maybe they're sending you a whole bunch of documentation. Maybe it's all these papers where you're like, oh my gosh, I have like 5 pages that I need to fill out. Please know that we do this because we want to make sure that we're hearing you, really trying to get to, okay, what do you need? What services are you looking for? How can I help you? Because as Becca had mentioned earlier, what we really want is for you to find those strategies, to help those symptoms that you're coming to us with, right? So we do need just a little bit of information, just so that we're able to make sure that we're meeting the need, that we're a good fit. So just so you know, you may receive a lot of paperwork and documentation, but it's how we really start helping you, right? It kind of starts from there. And another thing is, thinking about supports, families and friends. We know this process is a lot. It can be overwhelming trying to reach out, wait. Sometimes it's like, oh, I want to call, but I don't know. If you have family members that you feel like are very supportive and can help you and you feel comfortable with, see if they're willing to help you during this process, right? Utilize who you have in your corner, saying, hey, can you help me reach out, or can you help me look for someone? That's also a way that you can ask for help. So in the next slide, we do have a sample script, but essentially what I want everyone to think about is really, okay, so if I'm going to reach out, how do I do so? Kind of what's the language I use? So first and foremost, your name. I think that's the most important thing. Make sure you introduce yourself. Sometimes I've gotten phone calls where it's like, hello, this is what I need, and there's no name. So please, name is very important, but also contact information. If there's a number, or an email that you can slowly say, you can do that as well. 1 to 2 sentences about why you're looking for a therapist, and really 1 to 2 sentences, remembering that we don't want to overshare on the phone because that's essentially what the sessions are going to be for. So if there is okay, hi, my name is this, I'm looking for X, Y, and Z, this is what I'm looking for. That way is okay. And you'll see the example on the next slide, but just wanted to put that out there. So see, I'll go through this quickly. Like, hi, my name is John. I'm looking for a therapist, and wondered if you have any availability for a consultation. I have been struggling with anxiety attacks. I had cancer 5 years ago and would like to connect with a therapist who has a background working with major illness. I would prefer to meet virtually and have availability on evenings and Friday mornings. I have Blue Cross Blue Shield of MA insurance. You can reach out by phone or email. So you see how it's very short, very sweet, but it has the main information such as your name, what you're looking for, obviously, kind of the reason, what brings you, some information, what you're kind of looking for. Like this person, John, looking for someone who has experience working with major illness, their availability in terms of daytime, if they want to meet virtually or in person, and their insurance. Okay, so and then their contact information. So these are just some things that we would want you to think about. And, please feel free to take a picture and say, okay, how can I use this as my, working piece, my foundation to then tailor it to how you need it to be.
Thanks, Karen. So, I'm going to talk a little bit about once you get in the door with a therapist, what those first couple of sessions might look like and what to expect and how you can lead that a little bit. Um, so some things just baseline to expect. As Karen alluded to earlier, most patients see a therapist for 45 to 50 minutes, usually about once a week, some people every 2 weeks. So when a therapist says, I'll see you for the hour, expect that it's going to be about 50 minutes. There are some that go a full hour. It's really practice dependent. And your first visit is really going to be more of an intake visit. You're typically going to be spending that first hour answering a lot of questions. Sometimes therapists will have you do paperwork during that time and sign, their initial consent forms. A lot of therapists will have you do that before your first visit. And during your first visit, I always say to patients, tell me what brings you here today? The nice cliche question. And where do you see yourself in 6 months after, what would you want to see therapy do for you in 6 months? And that can be a really good way to frame your first session with this person. I want you to remember you don't have to go in there and tell them everything that's ever happened to you in that first session, because I'm guessing if you're here at Dana-Farber, you've had a good amount that you've dealt with, and that's a lot to talk about in 50 minutes. So going in with some of these more broad strokes and letting the therapist pull that out of you as it feels good. And also just to normalize that first session of therapy is really awkward and, strange for a lot of people. You might feel like safe and in that perfect space right away, but a lot of people, it takes a couple of sessions of building rapport and getting to trust the therapist before it's going to feel like natural and comforting. I usually say to patients, try going to this person 3 times, right? And if at the end of 3 times you're really feeling uncomfortable or like you can't open up, we're going to talk in next slides about how to handle that. But give it a couple of sessions before deciding that therapy is not for you. So another thing that I think is really important to talk about in that very first therapy session is how your therapist handles confidentiality. Many therapists will bring that up on their own, but it's totally okay to bring as a question to your therapist. There are some limits to confidentiality that we have as therapists. If there is any safety concern, that's the big one. So if we're worried about your safety or someone else's, if you are dealing with any legal proceedings or if you have any in the future, there's different ways that therapists have to handle that. And your information, if you're submitting through your insurance company does learn about your diagnosis and some other information. So it's important to ask your therapist how they handle confidentiality, what their limitations are, and just to have enough of a conversation that you feel comfortable talking in that room. Every therapist is going to be a little bit different, but follow some of these basic guidelines. So when you start settling into therapy, I always kind of say that those first couple of therapy sessions can be really emotional, and sometimes it feels a little bit worse before it feels better because you're opening up things in that space that you might not normally talk about, and it can be really hard. I hear from a lot of patients that they feel really self-conscious in those first couple of sessions, or they feel much more emotional than they expected to. And some patients will tell me they felt very shut down. They know this is a space where they're supposed to be able to talk, and it feels really hard and scary to get there. And that's all totally normal. And a good therapist is going to be able to help you work through that. Um, and it's if you're running into those feelings in that block, I think it's not up to you to move through the block. You don't have to push yourself any further than you need to. I do think it can be really helpful to tell your therapist, this is the feeling I'm having, or this is the block I'm having here. And it's their job to help you move through it. So I get this question a lot of how do I know if therapy's working? And the biggest thing is progress to you is going to feel like different than progress to me, and it's going to feel different than progress will to Karen. So we are all individuals, and therapy is going to work differently for different people. A couple of questions that you might want to ask yourself as you dive into therapy are, do you have a better understanding about your concerns, and are they starting to feel more manageable? Do you notice any changes in your day-to-day life? Are you taking the stuff that you talk about in therapy and being able to use it outside of the session? Or are you really just keeping it in the therapy room? And the big one, are your symptoms improving? So if you went in with a symptom of, I have anxiety when I have to go have a scan, does it feel like it's improving? Or do you feel like you're, on a path where this is going to start feeling better? And another question, how do you feel during therapy and after your appointment? Often we hear from people at the beginning of therapy that they feel really drained. I've heard the word emotional hangover a few times. And again, all totally normal. And it's a thing to keep an eye on, to keep talking to your therapist about so that you can start to feel better in those sessions. So we have some scripting here again because we love the scripting. So feel free to take a picture of this. You know, a lot of these are things I would suggest using if you're feeling like therapy isn't moving forward in the way you want it to, or you're feeling a little bit stuck. So you could say something like, I've been talking about some of my problems, but it feels hard to talk about a couple of things on my mind. I want to, but I don't. Does that make any sense? Or you might want to give your therapist a little bit of direction and say, I've heard that X type of therapy might help me with some issues. Is that something that you have training in? And your therapist can help you talk through that. Now, I think the most important part of what we want to talk to you about today is if you have emergency needs, how to handle that. So you're going to be going to a therapist for some of those longer term needs. If you right now today are having emergency needs where you have any risk of harm to yourself, harm to other people, you know, and it needs to be dealt with right now, we want you to call 911 or go directly to a hospital emergency room. If anything like that comes up in the future, that's again where you're going to go versus waiting for a therapist to get back to you. And then if you're having urgent mental health needs, and that means that you need to talk to someone like today or tomorrow, but not that you have risk of life or limb. We have in Massachusetts these really cool community behavioral health centers. I think of them like an urgent care for mental health. So you can walk in 24/7. You don't need an appointment, but you can call ahead and they can get you connected in the moment to a therapist who can talk through things with you and then who's going to connect you to longer term resources. So we want you to know that this is a resource that exists if you live in Massachusetts and if you live in another state, many states have similar systems. We just haven't listed them all here. So a really good access point for all of that is the phone number 988. That's our emergency version of 911 here in the United States. And we have a number of resources here. Again, this is a take a picture and save them for later. We have some general directories. We have some matching services, which Karen discussed earlier. And then there are a lot of specialized directories. So if you are dealing with postpartum care, there is a directory of therapists who are specifically trained to deal with that. Or if you are a person who is in the LGBTQ community and you want a therapist who is specifically trained and allied, there is a directory for that. So there are quite a few different types of therapist directories. This is a small portion of them. And if you are having trouble finding a directory or a resource, you also can reach out to your Dana-Farber team and find out if they have folks who they can refer you to. But thank you so much for being here today. Are we seeing any questions in there, Sierra?
I don't see any questions yet, but thank you guys both so much for this informative program on how to find a therapist. As mentioned, if anyone does have any questions, please utilize either the Q&A or chat feature to ask them, and then our panelists will be able to try and answer them. Thank you all for joining us today. We can give it a minute for any questions that come in, but none right now. And thank you both so much for your time.
For sure. We're very happy to have this opportunity, so thank you.
Yeah.
Yes, and thank you all who took the time out of their day to join us today. We truly appreciate it, and we hope that this information was helpful and that you can leave here with just a couple more resources.
Yeah.
Awesome. Well, thank you both so much. I don't think anyone has any questions, but all the information's there once it's recorded and posted if anyone needs to reach out to you. So,
It's good. Thank you.
all right.
Bye.
Thank you both. Take care. Bye.